My name is Sean Manion. I am the Chief Scientific Officer at Consensus Health. We are here to kick off the unconference for the Stop COVID-19 hackathon with Consensus Health, with Gitcoin, with other partners like Hyperledger, and I'm not going to go through the whole list today. The goal of today is to start interacting between some of the hackers who are around the globe and already signed on, as well as other people who will be joining us later, and our mentors who are coming from a variety of different backgrounds, but primarily are coming from health and life sciences in order to be there to help people understand where the data flows are, how the systems work, so that what's created during the hackathon isn't just created in isolation, but really can be geared towards specific problem areas and have real world value in trying to create solutions for those. So thank you all for being here. Thank you all for caring enough to try and save the world, because that is what we're trying to do. It's not going to be easy, and we're not going to do it all ourselves, but when you have a new problem, new tools is exactly the type of things that can help you get past that problem. And that's where we are. And it's not a singular problem. There is a singular, at least variants of an infection that is sweeping around the world and causing a lot of secondary effects. But there's a number of different problems that come from that. There are both direct health problems, there are indirect health problems, there are going to be secondary problems, mental health, problems with people who, have now no job, no way to support themselves, anxiety goes up. You have a lot of different areas that will not just be the main infection, but also be these secondary areas. And of course, the main infection has, how do we share data better? How do we get vaccines moving forward faster? How to make sure supply chain is there so we can get things where they need to be, both for hospitals, for PPE, for those providers who are involved in the frontline fight. All of these are open game for ideas. So there really is no closed area we want people looking at. The breakout rooms are for general areas, but you can attack the problem anywhere you want to. Going into some of the intros now. My name is Sean Manion. I have a background in neuroscience. I was involved with the federal government and research administration for a number of years, so I have an understanding how networked research works, doesn't work, and the ideas with respect to blockchain and some of the associated emerging technologies that we can use to make it better are one of the areas I really like to focus on. I just wrote a book called Blockchain for Medical Research, Accelerating Trust in Healthcare, which was meant as a way of doing just that, accelerating that trust by identifying those areas that you can apply this emerging technology to. Not a technical book by any means. I wrote it with a journalist in order to get people who maybe weren't familiar with the technology closer to being able to understand what it could do and work with people who have a deeper technical knowledge, and then also helping people understand where some of the challenges are in medical research. So I think that's a source of information for where different problems could be solved, but it's just one of many, many different sources.